Hi, I'm John Steuter. I'm sorry that because of the current situation we don't have this opportunity to meet in person, but just wanted to give you the chance to explain a little bit about Brian Hart and the opportunities that you would have with us rotating here as a resident in the future. Brian Hart is a large growing cardiovascular practice in the city of Lincoln. It's been around for about 15 years, starting out as just a few cardiologists, but has now grown to over 20 cardiologists and 5 cardiothoracic and vascular surgeons. The residency program is important to us here at Brian Hart for a lot of different reasons. A big reason, though, is a lot of the residents that complete their training here go on to take jobs either in the Lincoln community or in the rural areas surrounding Lincoln. And we have a strong relationship with a lot of those hospitals in the rural setting. And so we just have this strong interest in being involved in that education, as we know we're going to have the opportunity to work with those providers in the future as well. So it's what we think is the best thing for our patients, as well as developing those relationships with our partners as we go forward. So as a resident rotating with Brian Hart, we generally have a 2-week inpatient and a 2-week outpatient rotation. The outpatient rotation is spent mainly in our clinics with a couple different cardiologists seeing patients in clinic, dealing with routine outpatient care of cholesterol management, coronary artery disease management, high blood pressure management. Our 2-week inpatient, we try to get residents as much experience seeing sick cardiology patients, seeing as many procedures as they can possibly see, so they know when they're taking care of those patients afterwards, back home in their clinics, they know how to best care for those individuals. A great aspect of the ability to rotate through Brian Hart is the fact that we go to over 40 different locations around the 5-state area and rural communities, giving the ability to see how to take care of patients not only in a city environment such as Lincoln, but also in the rural environment and those outlying communities.
Hello, my name is Flor. I'm a second-year family medicine resident physician at Lincoln Family Medicine Center. I'm in the first few days of my cardiology rotation here at Brian Hart. It's a 4-week cardiology rotation that all the second-year residents in our program do. So it's a mixture of both inpatient and outpatient medicine. This first week I've mainly been in outpatient clinic following various cardiologists around. Some of the things I really like about it so far is just the variety of physicians that they've paired me with. I've been able to see a lot of different styles and different patient interactions with the different cardiologists. And everybody has different approaches to patients, and it's just given me a good idea of sort of the things that I can deal with in a rural family clinic from a cardiology perspective, and the things that I would expect myself to be able to manage versus the things that I might need to get some extra help on from a specialist like a cardiologist. In terms of being in a critical access area, you might be the only family physician in town or one of the few family physicians in town. You might have a very busy outpatient clinic that you manage your cardiology patients in or your heart patients in, but you also might staff or manage your patients in the critical access hospital, if not man the ER as well. So I think it's important to be able to know kind of what your limitations are as far as what you can handle when it shows up at your door, whether that be the ER or the clinic, from a cardiology perspective. So our program specifically, I think, is a very kind of family-oriented program. There's a lot of freedom within the rotations to make of them what you will. A lot of the attendings, when you first show up in the first few days of a rotation, they specifically ask you the question, what do you want to get out of this? Where are you going to practice afterwards, whether that be a rural community or wherever, so that they can specifically apply, the learning that you get on that rotation to what you're going to be doing in future practice.